question.
Yes.
Does it bother you if the feet aren't polished and pedicured?
Does it bother me if there's not a nice pedicure? No, I don't think so. I know patients have apologized ahead of time that they didn't get a pedicure before they saw me, which does not matter to me. But what I've noticed a lot lately on the foot isn't so much the pedicure as it is tattoos that people are getting now on the top of their feet, their ankle, their lower legs, some even on their toes. And they all tell me that they're extremely painful, but they're very happy that they got them. Two things about tattoos. Number one, we sometimes have to be careful if we do injections in those areas because they can change the pigment. But number two, I've done for a lot of my patients, we discuss the incision that I'm going to use if I'm going to do surgery and how's that going to look with the tattoo. Is it going to ruin it? And believe it or not, a lot of times we get creative where we place the incision as long as it doesn't compromise the procedure itself. We incorporate the incision and its healing into the tattoo so you can't see it as well.
Do you judge the size of someone's feet?
Do I judge like inside while I'm examining them?
Yep.
Boy, those are really, really small feet, or
Yep.
those are extremely large feet. I think if I thought they were extremely, extreme one way or the other, a lot of times it fits into the problem I'm seeing them for, so it just comes up in conversation. I may say, because of the size of your foot, you're experiencing this problem or that problem. So yeah, I make that analysis, but I'm pretty open about it.
Do you get grossed out by anything?
Are we still talking about my profession or just anything in general?
About the foot.
Because there are a lot of things that gross me out. But when it comes to my profession and the foot, I probably would say no. There's nothing that I see anymore that really makes me think twice. There was a couple incidents when I was a resident a long time ago that were pretty disgusting, shall we say, but at this point that wouldn't even bother me anymore, and I don't think I should get into detail about what that was. We're going to save that for another interview later.
So Dr. Felton, the question everybody wants to know,
Yes, Laura.
do you get pedicures?
Do I get pedicures? I can honestly say, and I'm not embarrassed about it, I have never gotten a pedicure.
You're a liar.
I have never gotten a pedicure.
Well, you're
I don't
missing out.
discourage the practice. People ask me that question actually quite a bit. Is a pedicure bad? Should I be getting them? For some at-risk patients, it's probably not a great idea, but I think pedicures are a good idea, and I don't see a reason why people can't get pedicures. My wife gets pedicures. Can I say that on this interview? She
Your
does
interview.
get pedicures. And I don't think she'll care if everybody knows that she gets pedicures. She gets very nice pedicures.
Is it weird when people's feet are sweaty?
No, I've had some patients, and they'll know when their feet get super sweaty because they preface the visit right away. I'm sorry about my sweaty feet before we've even taken shoes and socks off. I've had some people, it's actually dripping onto the exam chair and stuff, that they get that sweaty. That's a little unusual. Sometimes there's a condition people have that happens, but sometimes they're just a little nervous or whatnot, but nah, doesn't bother me. It's not weird.
Does it bother you if women don't shave their legs?
Professionally speaking again? Or is this a general question? Just kidding. No. I probably don't even notice.